Hi everyone, I'm Doug Beall. I'm an interventional musculoskeletal radiologist practicing in Oklahoma City. Whenever I look at the 26 different companies and the variety of offerings that they have to fuse the joint, I really like Genesys. So Genesys has elements to fuse the joint from posterior to anterior. It has elements to fuse the joint posterolaterally and direct lateral to medial. And so whenever you have something, if you choose a single method to fuse the SI joint, let's say you choose a posterior to anterior approach, and I have cases of this, I have patients that I've done this on, quite a few in fact. And if we choose to do it because it's minimally invasive, it's elegant, it causes very little soft tissue disruption, and the vast majority of time we know that that will work, and it will work extremely well and be durable. What if that implant will erode over time? What if you have bony resorption around it? Then what? Well, the answer is to come back and do another method. If you do a posterior to anterior approach, you can always come back and go posterolateral. You can go lateral to medial. You can go around the implant. You can leave the implant in, a sort of double support mechanism, but you need to be able to have the other implants. You need to be able to have the other devices, the other approaches, the other methods of fusing. And if you don't have the other methods of fusion, you're kind of stuck with one device just to go from posterior to anterior. Whenever I look at companies to provide equipment to help me treat the patient who needs an SI joint fusion, I look to companies that have all three approaches covered, and I look for companies that have all three approaches covered in a real elegant, complete manner. And so if I have one device, I can pair it with another one. If I have one implant that doesn't successfully accomplish its goal, I have another implant ready to go from another approach. I can use a combination of approaches, and so this is really why I choose Genesys. Thank you for your attention.